All right, all right. Happy Wednesday. It's Clear Vision Wednesday time. I'm Claudia Mühlenweg, creator of the Natural Clear Vision Method and founder of the Natural Clear Vision Institute. And like every Wednesday at noon, we go live here on YouTube to explain all kinds of things about vision, about how to improve your vision and your eyesight, what are factors that could affect your vision that you might have never heard about. And today is one of those topics where I didn't know there was a connection. I mean, it makes sense for me, but I wasn't really aware of this. And I have an expert on today that will highlight all these things. So let me bring on Katrina Foe. Welcome to the show, Katrina.
Hi, great to be here, Claudia.
So your expertise is cancer, which
Yes.
is something that I thankfully never had to experience, but I had family members. In fact, my dad passed away of cancer many, many years ago, way too young, just after retirement. And other family members have been diagnosed with cancer. Thank God everything worked out. But I'm really curious, first of all, how did you get into this work? And then I want to learn a little bit more about how does this connect to vision?
Yeah, absolutely. So I have been interested in health my whole life. I have a background as a Pilates teacher trainer. And I was pregnant and then nursing, and I had a mastitis and found this golf ball size lump that I thought was just the mastitis. And when that went away, the golf ball was still there. And I was not super concerned. I was, 37 years old at the time, and I did not think that was possible really for me to have cancer. I felt great. But my mom pressured me to dig in, and it turned out this was so weird that my grandma had had a double mastectomy, but no one really knew if she had cancer. I guess they didn't talk about it as much then, and she was very private. So we thought she had cancer, and my mom was really scared for me. And I knew enough at that point that I wanted to kind of explore some alternative things. We'd had some really dramatic food as medicine experiences as a family. So I'm not against standard of care, but I went and found out it was cancer. And from there, decided to address it all natural and, did no chemo, radiation, or surgery, and looked at things from a functional perspective, which just opened this huge door for me because I had never done anything like functional testing, and was able to get rid of the cancer in about a year.
So let me ask you this. Well, first, how did you find out it was cancer?
Yeah, this is the huge thing because our diagnostic technology, that our standard of care, you get your mammogram, you get an ultrasound, and you get a biopsy, and that's always the way. And I had talked to some people and realized that the mammograms can cause cancer, and the biopsies where they draw the needle out can drop cancer cells and create secondary tumors. They call it, track marks. And so I didn't really want to go that route. And a friend directed me to blood biopsies, which are where they're drawing blood. So it's very not invasive. And you can see the circulating tumor cell. And they even have the technology to see where it's coming from. Like, is it a breast, cancer cell? Um, I was also interested in thermography, but like I said, I had been nursing, so my whole breast tissue would have been showing up hot on a thermogram, so that wasn't really an option for me. But it's interesting because some of the technology, like a thermogram, you can't diagnose from. They would still have to go into like a biopsy or something from there. But the blood biopsies you can actually diagnose from, which is pretty exciting.
So we will definitely dive a little deeper into that because obviously I've been getting my mammograms when I had a family member with breast cancer. I was like scared and I haven't done them in a while but I never felt good about them, but not really knowing. And I think a lot of our listeners also don't really know, like, because we want to catch it early on. We don't want to wait till, people I know that had stage four and then they were basically on their deathbed and passed away. But I want to talk about vision because that's really our main, our connection to the work that I do. So, how did you and your own work, or when you work with clients, how has your vision changed when you got that count? Like, how was the connect, or what is the connection?
Yeah. So, and I'm sure you talk about this a lot with this group and your clients that, vision is very connected with stress levels. And so for myself personally, I had already seen like every time I got pregnant and then especially postpartum, like after the birth, which is fairly traumatic to the woman's body. Um, as well as with the cancer, I noticed a just very huge difference to my vision and what I could see. And like if I'm looking across the room, can I read the spines of the books and such like that, as well as nearsighted and farsighted, both of them. So I had already seen that connection, but what I see now is with my clients as I'm going through and helping them with dealing with toxins and stress and hormonal imbalances and all this. I am very big on talking to them about noticing what I call their whispers, where their body is talking to them, and sometimes it's very subtle. And one of the things that comes up is my vision is declining, my vision is getting better. And you can see the connections between, like, oh, you're going through chemo, your vision's declining. Oh, you're going through extreme, detoxing mold, your vision's declining. Okay, now we're seeing it on the other end getting better. And there's very strong connections with what your body's dealing with and how, your vision and your other whispers too.
I love that, noticing your whispers, because a lot of times then it's like, especially if you're like in your 40s, you're at that age where like, well, it's just, I'm in my 40s, everybody loses their eyesight. And so, but I noticed that too when I did, after I got rid of my glasses and I did my first liver cleanse and detox, my vision got so blurry and it freaked me out. I was like, oh my God, what's going on? Like, because so anyway, I learned, and then when I came on the other end, it was clear again, fasting. But it's always interesting. And I always tell everybody, stress is really the number one root cause of blurry vision. And it's like for every one of us, I go through stressful phases sometimes, but I also know, so everybody, I want you to also know that your vision will vary a little bit. Of course, it's not going to be like, hopefully, like a crazy blood sugar spike, but it's like there is subtle changes based on your stress level. So I want you to all know that stress regulation is very important. But let's get back to cancer. So that is just it's basically a huge stress on the body, physically, but also probably mentally and emotionally if you find that out. I mean, cancer is still, the big C word, the scary thing. And so that you are at a higher stress level. So you find that with your clients too, that sometimes they notice those whispers, which is a great way to pay attention, right, to all these.
Yeah.
Are there any
Yeah.
other senses that change? Not that that's my expertise, but I'm curious, what about olfactory or hearing? Is anything else affected, or is it mostly vision?
Vision, I think, is the clearest, but people have such a huge variety of symptoms to stress. And with stress, I mean, yes, the mental emotional component, but also, if they're, metabolically dysregulated and their blood sugar's crazy, if they've got parasites, if they've got some kind of infection, like all of those are going to be stressors on the body and affect their vision, which even if they can't see, if they have toxic levels of mold, their body still feels it and it'll still have that eyesight connection. But yeah, clients can have reactions all over the place. So I like the term whispers because it's generic. But some people have itchy patches, some will have like drippy noses or coughs or like digestion issues. I mean, it's all over the place. And what your whispers are not necessarily at all what mine are. And because with cancer, one of the biggest things that people get confused on is they think there's like one thing that caused their cancer.
Mm.
That I see with the testing is there's usually 7 or 8 big components that are off. It has to be enough to like overwhelm the immune system from doing what it's designed to do. So when you have like 7 or 8 things, the different symptoms and whispers are going to be wildly varying.
Okay, so can you explain a little bit, like when you said 7 to 8 big components? Because what you said so far, a lot of times when we hear like, I'm dizzy, I'm tired, I have headaches, sometimes like, we find like, oh my God, there's 200 conditions that have these symptoms, right? Like, so when you say that 7 to 8 big components, like, can you give us some examples which you see commonly as a precursor to the body might be experiencing cancer already, or it's kind of on the track to get there? What are some of those things?
Yeah, so there's 10 areas that I look at. The stress and circadian rhythm stuff is one of them. The emotional like trauma, usually a year prior to cancer, there's some emotional trauma. And I'm being vague because it looks really different with different people. That's a
Mhm.
whole nother bucket. We've got the metabolic balance, which is like the blood sugar stuff, the microbiome, so pathogens, digestion, all of that, inflammation and oxidative stress, hormone balance. So, sex hormones is a huge one, especially with things like breast cancer, but also thyroid. I mentioned the stress and circadian rhythm. We've got, which would be the adrenal hormones. The toxins are so huge, so huge. Mold, heavy metals, chemicals, all that. The immune system, so, viral load, vitamin D levels, all this kind of stuff. We're looking at the genetics, so really how the epigenetics can help, turn things off that are going crazy. And then angiogenesis and metastasis. So what's going on in terms of blood supply and such to the tumor.
Okay, can you quickly repeat those things? I was trying to take notes. So for everybody,
Yeah.
so I got stress and circadian rhythm, which is a big thing for vision.
So
Emotional trauma, big thing for vision. A lot of times, the reason we got our glasses in the first place, you talked about metabolic balancing, like the blood sugar, insulin, obviously. And then you talked about, I think, microbiome. And then can you, what was the fifth one?
inflammation and oxidative stress,
Okay, oxidative stress, which is obviously also huge for the eyes.
right?
Hormones. Obviously, insulin is, part of the hormone, but the sex hormones, right? You talked about.
Sex and thyroid. And I think just in general, when anything is off, it's going to create stress in a lot of ways. The toxins are a big one too. That's the next one. And I
Mhm.
see a lot of connections, especially with mold, which no one's talking about mold. And this is a very known carcinogen. I mean, you can't sell a house that has known mold because it's so toxic, but yet, and it's known to cause cancer, but yet they don't test cancer clients to see if they're living in a moldy house.
Oh, I did a test not long ago and I had high levels of mold, but then my health practitioner said, "Are you drinking coffee?" And I said I did. So now I switched to a coffee that is the mold-free one. But I know it's a little side note, really quick. What are your thoughts on coffee, generally speaking?
Okay, so many thoughts there. So I would tell you if you have high levels of mold, it's not from the coffee. Um,
Okay.
the coffee, unless you're drinking like gallons and gallons a
Oh
day,
no, 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 no.
right? Yeah, you want to check your house. If someone has high levels, it's almost always in their environment, water damage kind of
I
stuff.
cleaned out an old house that had mold, and
I'll
that
do
was,
it.
yeah, yeah, yeah. So that makes sense. But I'm not a person who felt like, well, actually, that night when I did clean out that basement, I did actually feel like, almost like getting a cold, feeling sick. But usually, even with EMFs or other things, I'm not somebody who's like ultra sensitive in a way where I know, like other friends I have that are literally sick, like in bed, So I've never had that, but obviously my body is still dealing with all this, and
Yeah.
so okay, so mold
This
exposure.
is Claudia, what you're saying, that was me. Like I am not the sensitive one. And my
Uh-huh.
clients, they're middle-aged women that are the healthy one in their friend group. They're not feeling sick and they're like, what the heck? How did this happen? Because you don't have to feel bad to have cancer. And a lot of these people, I feel like they're really good compensators. Their body is really good until all of a sudden, whoops, there's a tumor, and their immune system missed it because it was juggling so many things and making it all work.
Oh
Um,
my God, this is so, like, I'm definitely like what my friend Dr. Manon Bollinger always calls the healer in every household, the person who's always the bro. Like, this
mhm.
is so interesting. So you find that we are often, is it also like that feeling of like you're always trying to be like the helper syndrome is like what talk about, okay, sorry.
Everything for everyone, right? We don't
Yeah,
take care of ourselves. We just keep going one foot in front of the other kind of stuff. It's
right.
so a strong cancer profile with it. And you had asked about the coffee. So I'm not super anti-coffee. I would want to look at someone's adrenals to see if it's an issue, but I
Okay.
am anti the mold in the coffee. And when we're on the topic, I mean, because there are mold-free coffees now, dangerous impurity and such. But peanut butter is just as bad in terms of the mold. And people will go eat their Brazil nuts and those are moldy. And so there's a lot of things we need to do in terms of our food, if we are, but the bigger thing, like I said, is the house usually.
Okay. And then cashews are also, I was supposed to not eat cashews because of mold, even though they make such great yogurt. That's really, really helpful. So when we look at, I think we're looking at all these different pieces, but to complete that list again, because we were stopping at toxins and mold, and then you had immune system, um, right, as number 8, and then you had genetics, and then I don't know what the last one was. I kind of missed out on that.
This one's more cancer specific, but we can see markers for angiogenesis, which is the production of new blood vessels.
Uh-huh.
Tumor actually hijacks our own body to make itself blood vessels so it can get more of its fuel source, which is the blood sugar, the glucose. And that process we can look at and see, as well as there's some markers to see if things are, the tumor's left the building, starting a new one with a metastasis.
So obviously with diabetic retinopathies and other eye diseases, there is the same thing happening in the vessels in the retina. Do you know, I'm not blaming you for no, but do you know if like sometimes cancer can be found in an eye exam? Because I know so many things can be discovered in an eye exam too.
I don't know, but my view is that like what's going on with your vision is a good mirror for what's going on overall.
Hmm.
So if it starts to deteriorate, a lot of these other stressors, because all these things could be almost considered stressors because they're burdens on the body, they're going to influence. And when, you get too much, your vision starts to blur and you start to get symptoms and, it looks a little different for everybody, but these are issues.
Well, sometimes I feel like this list, we talk about glaucoma, and glaucoma is a pressure-related optic nerve affecting silent vision killer. You lose your peripheral vision. And it's like the perfect A's, the perfectionist, the all ducks in a row. And I was always thinking, oh my gosh, like it's almost like that describes me. So what you said about cancer is it definitely looking at our, personalities. And I think now that I'm in my 60s, I'm definitely much more like chill in a way where I'm like, I don't care so much about these things anymore. You know what I mean? I care about the work that I do and doing this thing well, and but not so much about all, being the perfectionist and everything has to be. But I think when we are younger, a lot of times, especially you said a lot of people that you work with are in their 30s, right? We are still in that, we're not like in our 20s anymore, but we're not in midlife yet. And we're kind of in that. Can you describe a little bit more about that person that is might be susceptible to cancer, that is not like just the what they call old age, more common cancers?
Yeah, so the clients that I tend to work with are younger, like you said, and they're feeling good. They're not having like what you would see on the outside as a profile. But when we dig in and do the functional testing, there's, like I said, 7 or 8 things going wrong. So usually they've got some hormonal imbalance. They've got some genetics that are, maybe they're not good at detoxing and methylating and the blood sugar. These things are maybe not their strong points. And a big one, because, cancer is a metabolic disease, they usually have some form of insulin resistance in some degree. And the crazy thing is, when we talk about blood sugar issues, we're always talking about hypoglycemia when we talk about symptoms, and that's where you've got that shaky, hangry. But if you talk about high blood sugar, you don't feel bad. You feel really good. You've got tons of fuel running around your body, and it's a big deal. So they may not feel bad like you typically think with somebody.
And when I highlighted cancer as a metabolic disease, I think that is one of those like writer downers, because we think about blood sugar and diabetes, and we don't really think about cancer. So I think that's an important one. And I know
Yeah.
we can talk a little bit more about lab markers that you work on, but I work a lot with blood sugar. Personally, I have one of those sensors in my arm right now, and because diabetes is the leading cause of blindness, and so it's an important thing for me. But what kind of let's just pick that one right now. Like, what kind of markers do you think somebody should like have to be healthy and not to, to be kind of on that prevention path in terms of hemoglobin A1C, fasting blood glucose, insulin? Like, what are some of those markers that you think should be ideally, what range should they be in? Is that okay
Yeah.
to say?
Yeah, I think we have no problem with that. So with the hemoglobin A1C, I think that's the most important. Um,
Uh-huh.
It's got the average of the last 3 months of your blood sugar spikes. So it's really giving a nice full view. And I want that below 5.4, ideally below 5.
Uh-huh.
The fasting glucose, I don't feel is a very helpful marker because that can really be skewed by people's stress levels and such. And, if they're um, how they're sleeping, and there's so many other things going on there. The insulin is very important. I like to get that as low as possible, so that they're not having tons of insulin that's needing to be. And again, this is related with the insulin resistance. When it's high, we've got that going on. So those are my big ones. And then for me, I'm looking at getting my clients into ketosis. So I want to have that blood sugar really nice and even, and I want to get the ketones up because they're free. Our body makes it, and they're known to shrink tumors, all sorts of great things. And when you're making ketones, you're not eating carbohydrates, and that's the number one source of oxidative stress production in our body. So you're getting all these multiple benefits in getting into that state.
That sounds great. I'm curious. I used to have one of those Keto Mojo devices, and that a new one. And then so is that how you recommend? Because I have a now with CGMs, we put in our arm or testing your glucose, and I also test postprandial one, which means after eating. And I would think that's something that you don't want those big spikes. You want it to be how do you test ketosis or ketones? Is that with that Keto Mojo meter? Okay.
Yeah. Keto Mojo is where I work with my clients to get started to find out if they're in ketosis. So there's different strips for ketones versus the blood sugar,
Right.
and doing at home testing to test, before the meal, and then like every half an hour after the meal to see how high did the blood sugar go? How long did it stay high? So they can really do that on their own without having to drink that toxic orange drink. They can eat a meal they would actually eat at home. The CGMs are really crucial as well, and I use Thea with that, because sometimes clients will have things where they're like eating perfect, and we use chronometer to really dial in the macros, but they're still not getting into ketosis. And this is super common with mold, as well as some other different hormonal imbalances that will accompany that. So, problem solving. Like, for example, I had a client that was like, oh my gosh, I put that CGM on and I realized that every time I get an email from my boss, my blood sugar goes up. And I'm like, yes, this is what we're trying to look for. Because like we were talking about earlier, it's not just food, it's stress that's causing those spikes too.
So that's interesting. You mentioned a bunch of things that Chronometer is a great app that is free. You can also pay. You can track all your food intake in many easy ways. I got to get back on that, and I definitely want to get the Keto Mojo meter again to kind of see. I remember when I did it that one time before I had trouble getting into ketosis myself unless I was fasting. And when I wasn't fasting, I was never in ketosis. But I didn't try this for a very long time. And I think the strips had expired or whatever. And at some point, I had other things going on. But so this is a good reminder to maybe try that again. The Keto Mojo, we can put that in the show notes or in the description, is basically a glucose and a ketone meter. You get different strips. But it's the same meter that you're using. So you only need one device and then you buy two certain kinds of strips, correct? And
Yeah, I have
for
a friend
non,
that's working on insulin strips, which would be even better too, even more.
yeah, that would be great. And chronometer or chronometer without the H, it's can put that in the chat. That's a great app that I think is very useful, just to kind of for a while to kind of track stuff, to get because I like that you could do it by weight, by cups, by whatever. They give you all these choices, and they have a lot of like let's say you buy I don't know Trader Joe hummus, whatever. They have a lot of these store brands in there. So if you don't make everything from scratch, you can also they made it really easy, I think, to track.
Yeah,
You
and I look at that as like an educational tool where people can find out, because most people know that if you're trying to cut your carbs, like don't eat the cookies and the bread, like
right,
duh.
right, the obvious stuff,
But
right?
but they may not realize that cocoa powder, or onions or something have more carbs than maybe you think. And so,
But wait, onions and coke. Oh my God, now you're destroying my day.
they're not bad. It's just you want to, they have more than you think. Because I don't think of an onion maybe or cocoa powder when I'm thinking, carbs. So it's just a matter of, when you're trying to dial in the ketones, you can use the chronometer as a tool to really see, oh, wow, that was a lot of carbs. I didn't realize that would be as many as it is, kind of thing.
Right. That is really helpful. So that's it's a great also to track your nutrients. You
Mhm.
talked about Brazil nuts being moldy. Like, how do we get our selenium without Brazil nuts?
Tricky. It's tricky. And I will just tell you a lot of times I will just go for the supplements because a lot of the nutrients are not in our food as much as they used to be. And
Right.
we should get selenium in our water and such, but most people don't get that.
Yeah, that's where we get into mineral water. That's the whole topic I love. Or like the TDS, when you have zero water, they want no TDS, but no, we need all these minerals, right? So that's a whole different discussion. But
Mhm.
so what kind of tips? Okay, let's talk about prevention of cancer because hopefully we don't get diagnosed. When we get diagnosed, we will also talk. I want to ask you quick, like also like what is the best way to diagnose? But let's talk a little bit about prevention first. I think that's more important. And then what do you recommend? Because you talked about not being a fan of mammograms and the biopsies, which make total sense. They pull the needle out, and all of a sudden you get that, right? You get that dragging of the dirt. It's like it's if you have muddy shoes and you walk through the whole house, right? So that makes sense to me. But what can we do for prevention? Obviously, stress relief, I would say diet, but what other things do you recommend?
Yeah, I mean, there's some real low-hanging fruit that I think everyone should do. Now, whether you get into full ketosis or not is not the point, but like just generally getting the carbs down is a huge thing because the blood sugar dysregulation is epidemic, especially in America, but like all the big scary diseases, whether we're talking about cancer or heart disease, Alzheimer's, all this stuff, the root is that blood sugar dysregulation.
Uh,
So working on that is one thing. I feel that it's really, really important inflammation wise to get the seed oils out. So, the canola, soy, corn oils and such that can be super inflammatory and, swap them out for things like avocado oil, olive oil, coconut oil, things like that that are
uh-huh.
um, much healthier and not the polyunsaturated ones that have been messed with, so to speak. But those are some big ones. I mean, the work that I do with my cancer clients, where I'm testing all these things, I mean, this works just as well for prevention. The problem is that most people aren't in, pain of the fear of the diagnosis to be motivated to do this work. And because it's not covered by insurance, that's a whole nother topic. Most people don't want to do this work, but looking and getting your hormones balanced, working on your gut, all this stuff goes a long way towards prevention. And I can't say enough about the toxins. I mean, I had already cleaned out. I was the person that made our own toiletries, use like coconut oil to wash my face and such, when I got cancer. So we weren't using the toxic stuff, but doing the testing, I could find out where I was still being exposed to things. And then, of course, like I mentioned, I have sucky detox genes, so I wasn't, processing them out well.
Yeah, I have that same thing with the detox. So, what else? Like, what do you think in your case, being already so healthy, what do you think for you? Obviously, we never exactly know, but what do you think for you was one of those reasons that you got cancer?
Oh, I know exactly. You
Oh, you
can
do? Okay.
know. You can, and that's my guarantee is I will tell you why you got cancer. We can do the testing. So I had insulin resistance. I did have emotional trauma. I was in an abusive relationship. I had had like 30 rounds of antibiotics, so my microbiome was pretty dead.
Hmm.
Um, I had a lot of inflammation, but my estrogen dominance, I had really high toxic levels of mold. Um, I had some Epstein-Barr virus that was activated
Oh,
and
you had everything.
I had everything, crazy low vitamin D levels, and then some really fun genetic hiccups, especially the methylation was a big deal for me.
So vitamin D is important. It's interesting. When I first got into this functional medicine stuff, mine was like 38. and I took 20,000 units a day and it got up to 80. It was great. And then I lowered. And then I haven't tested in a while and I actually stopped. I forgot where my supplement was and I just tested again at there was a great new Better Way it's called. It's a startup in Austin, but they use very little blood to test. And one of the, as a speaker, I got the free little panel and that included vitamin D. I was like, holy smokes, it's that back down to 38, 6. So because I have also issue with this, but because I do the sunlight, I do a lot of sunlight, but I have problems with the genetics to actually use the sunlight to properly. So I
Yeah.
can't explain this probably, but I know that I need to supplement. Basically, that's the long story. And I was like, wow, it's really low. So that's also an important one to make sure, vitamin D is always talked about with bone health a lot of times. But for cancer also, right? We need
Yeah.
everything balanced.
That one probably surprised me the most because I'd been taking high doses on a regular basis for years but I never tested my vitamin D and I was super low. I was in like the teens
Oh
and
my gosh.
yeah. It was really low. And I started like a high dose cod liver oil. I was going to do it kind of more natural. It did nothing. I was at the same level. I tried 5 different like therapeutic, like the best of the best, most bioavailable. They did nothing. And I would take high doses for 3 months and then retest. So this took a while. And finally, there was one that was a brand sports research, the coconut oil. It was in coconut oil. And when I retested, I got a notice of approaching the level of toxicity. And I was at 125. I'm like, toxic? You know,
Well, finally you got it up, right?
I got it up and I've been able to keep it up. And that one's just really works well with my system. And I have the issues with converting and creating that fat soluble vitamins as well. So it's something that's on my radar, but I just can't tell people enough like, don't just assume because you're taking it that you're getting it. You really want to double check because not all forms are as well absorbed and it's very bio individual.
That is so interesting because coming from this big health optimization, from the health optimization summit, there's all these vendors, and at some point you're like, well, you're saying yours is best, and you're saying, but you're basically saying test, don't guess. So
Yes.
try something out, take it for a while, test again. And the vitamin D test is not that expensive actually, but it's a really good one to do because I agree with you. Like we can take all this stuff, we can, spend hundreds a month on all these supplements but we don't really know. So I would love before we find out where people can find you, so basically we started with this, so kind of full circle. So what do you recommend in terms of, like obviously depends if you have cancer in your family, if you're at a higher risk for the genetics, let's say for breast cancer, but what do you recommend as a way to make sure that you don't wake up one day and you find out you have stage 4 breast cancer? Like what do you recommend in terms of testing? You talked about the blood test, but it's like, what is the like way to check how we just do our wellness checks? Like we get, what do you recommend?
Yeah, I think looking at I mean, obviously I'm biased. The functional tests are going to show you all this stuff ahead of time, which then saves you from going down the route of, whether it's cancer, heart disease, all these things. But in terms of specific cancer diagnosis, there are non-toxic pre-nuvo scans that have no contrast dyes, no radiation. Those don't diagnose, but you can see kind of like the thermograms. They don't diagnose, but you can see if there's an issue to kind of avoid maybe the mammograms. The problem is that if you want to do any part of standard of care, which I'm not against, there's a time and a place for standard of care, but they will put you back into you have to start with a mammogram again,
Mm.
which is very frustrating. So this is what I tell my clients, if you got to look at the end, if you want any part of standard of care, whether it's the chemo, the radiation, the surgery, just even having the oncologist analysis, or even to do the like HER2 positive, triple negative, aspects, looking at that, you have to do the mammogram. You have no choice. So it's all irrelevant of what we want. If you're willing and interested in stepping outside the system, there are FDA approved recommended ways of doing that. Like I mentioned, DATAR for the blood biopsies. Um, and you can address things your own way. I'm a big thing on test, don't guess, because So many people are, even driving cancer without testing, like they're doing things like a G6, I'm sorry, like an IV vitamin C without doing a G6 PD to see if it's safe, and they're not looking to see if it's, what would really help and move the dial the most. But in terms of diagnostics, it's kind of crazy.
Yeah, because I think I want to point to that thing, like we do want to know at some point what's going on, right? That's how we can address it. I do want to know that I have mold, even though I don't feel like I have mold. So we are saying, and I'm usually a big believer in most cases of a holistic approach that sometimes must involve Western medicine. But my point here is what I'm trying to find out. In order to get a diagnosis, I put that in the YouTube chat. The Datar blood test is a way to actually find out. You can do the thermograms. You mentioned a pre-no-evo scan, so you can do those scans, and that will tell you have a lump, or like what exactly do you find out from those scans, and what's the way to find out you actually have cancer, like how to get an actual diagnosis.
Sorry, I spelled it wrong. I put the Prenevo name in the chat. So that does scans so it can see. I use that with my clients. I'll refer them out and they go direct to consumer. So you don't have to have a doctor writing a prescription for Prenuvo, but they're not in every city yet. But those are going to show, like, if you've got cancer and it's growing, you can see that because it's very high def. Uh,
Uh-huh.
but if you want like an actual diagnosis, you do need something like a DATAR, which is going to give you that circulating tumor cell count and such.
Okay, gotcha. So that's the way, and obviously none of these are probably paid by insurance. So if you are relying on insurance, there's yeah.
Yeah, and that's the hardest part for people is when it's a matter of, do I want to go natural, more natural, less toxic, or do I want to get it for free? And it's
Yeah.
a very hard choice. And I feel like that hopefully will shift sometime where we get to choose as the consumer. But right now we're at the mercy of what the insurance will cover. The cool thing is though, you still do have a choice. You still can order those other things
Right.
and use them. It's just not necessarily going to be free.
And sometimes if you have a budget concern, maybe doing the one-time mammogram, finding out, but then spending the money on this on the functional medicine way to get rid of it. I mean,
Yeah.
I feel like sometimes we have to make an individual decision what makes sense for us financially. And I agree with you with the same with vision care. I wish there would be a point where people have the option. They could do the vision improvement that I do, or they could say, I don't want to do that. I don't want to do the work and just get the quick fix. I always do that in quotation mark because there is no quick fix, but get glasses, contacts, or surgery. But there is the option that people have a choice, and I think that that's what you're saying too. We should be able to have a choice as to how we want to approach this. So anyway, this was super interesting. Let me see on YouTube if there's any questions. So basically, those are just particular vision eye doctor questions that we have right now. I don't see. What about fibroid? There's a question. What about fibroid cysts? I guess. Is
So fibroids aren't necessarily cancer, but they're, cyst. And anytime the body does something weird, whether it's a, calcification bone spur or like a cyst or something, my brain goes, why is it doing that? And so
mm,
that why, that root cause is what a lot of this functional testing is going to get at. And the cool thing is we're getting better and newer testing that we can see more every day. So usually there's some root cause issues to why the fibroids are there. And
interesting. I had a fibroid cyst in my breast at 21. And back in the day, I was born in the 60s, early 60s, very early 60s. They would do a quick cut, what they call a quick cut. So they put you under, and then you don't know if when you wake up, if you still have a breast. It was like the scariest thing ever. And mine ended up being a benign fibroid cyst, and they just removed it. But I didn't know any better back then, right? But I was like, and you read later on, oh my God, this was in Germany. And it's like, I think it's so important what we're doing here and the work that you're doing, really educating people on all these things so that we can make better and smarter choices. And we can still say we want whatever standard treatment, that's fine, but at least we know like the pros and cons and how can make an informed decision. I think that's what is important to me. And it sounds like that's really what you're advocating for, is really understanding all your options and, you know,
I feel
being
like for me, the choice was to go natural, but I I really believe in freedom of choice. It's the person's body, they get to choose. So I, as a practitioner, I want to support people in whatever they choose. So a lot of my clients are working integratively where they're doing some forms of standard of care, whatever they're choosing. And the cool thing is that, when they're in a state of ketosis, when they're getting the toxins off, when they're reducing their stress, all the standard of care works better. I mean, this is in the research that a ketogenic diet, when you're going through chemo, makes the chemo more effective. And that kind of stuff needs to be out there because they're serving them like donuts and lollipops and
Oh,
stuff in the chemo labs, which is insane to me because that's not going to make it more effective. So, yeah, I think it's important to really integrate when and where it's appropriate. And it's really about that person's belief system and how they want to treat their body.
I absolutely love and appreciate that about you, and the ability that you're not, you know, telling people to go elsewhere if they decide that way. But really, I love it, makes everything better, right? When you do that root cause approach, even the standard care, it just makes it more effective and better. So thank you so much. Where can people find you? What is the best way to connect with you or potentially work with you? Uh, yeah, let us know.
My website is cancerfreedom.com. And you can apply if people are interested in working with me. You can find out more about the testing. I have an ebook that goes into it more. You can grab that as well. And then I'm on Instagram. It's just my name, Katrina Foe.
Great. Well, that's pretty easy to remember. I will make sure we have that on the show notes on YouTube, by the way. So if you want to, well, somebody says they're addicted to sugar in the comments and YouTube. Well, here's the thing, and I love I want to tie this bow too, because when you talk about the pain points, a lot of times I get clients like with already this diagnosis where their vision has already gotten a lot worse. But I always appreciate somebody. I'm just noticing my vision is getting blurry. What can I do? That's always the best. But as humans, we tend to sometimes procrastinate or, so addiction to sugar, it's a very, what didn't they say it's like more addictive than heroin or cocaine or something? Or
Yeah, it is. And I was there. I was that girl.
me
And
too.
I was shocked. When you have a cancer diagnosis, it's like you're forced to do something about it. And when I forced myself to cut all the carbs, and I started feeling, I mean, it was a little rough, and I did not do it as gentle as I do with my clients now, because I learned some things along the way. But I was shocked at how my brain lit up and how much more energy I had. And like, frankly, I don't miss that stuff. I broke the addiction, which was really powerful and exciting. But yeah, you've got to have enough pain, like you said, to really, motivate you to do something about it.
I agree. So where there's a will, there's a way. I think that is very true. And I quit smoking, which was a very crazy addiction. And
Mhm.
so I think we can do it, but like I said, we have to decide once we have the decision made, it's actually not that hard. And yes, but yeah, I was the same way. My grandparents had a bakery. I grew up eating pie every day. I mean, I was like, trust me, sweet tooth galore. So I could do it. You could do it, Katrina. It's possible, but we all have to make a decision for ourselves. So thank you so much. Goodbye, YouTube and my Clear Vision Club members. And Katrina and I have a little extra time to talk about all things cancer and vision. So goodbye, YouTube. Make sure to subscribe and follow me and check out Katrina's website. And you would definitely want to, especially if you are at a risk for cancer or you know somebody or you have cancer, definitely reach out to her. So